It'll be here. Good afternoon, everyone. Well, thank you. Thank you all for coming for this groundbreaking ceremony of the new behavioral health urgent care in Belmont, Harrison, and Monroe counties. I'm Steve Bosart. I'm Coleman Health Services Vice President for Development and Marketing. And as we kick off this ceremony, it's my pleasure to introduce you to Hattie Tracy, the President and CEO of Coleman Health Services.
Thank you, Steve. I appreciate the introduction. Good afternoon. We are so excited to be standing here today with our partner, the Mental Health and Recovery Board of Belmont, Harrison, and Monroe counties, led by their Executive Director, Lisa Ward, to break ground on this new behavioral health urgent care center for the communities. We're thrilled to have Governor DeWine with us today, as well as Director Leanne Cornian from the Ohio Department of Mental Health and Addiction Services. And thank you to all of you who have come here today to support this project that will mean so much to this community. This is an amazing project that will add a crisis stabilization unit to the community while also including 24/7 crisis assessment walk-in center and a place for our mobile crisis teams. All of these components together will create our behavioral health urgent care center. In 2021, Coleman opened its service location for Belmont, Harrison, and Monroe counties at Bayberry Drive in St. Clairsville. We are providing a variety of behavioral health services for the community at the location and treating substance use related addictions, bipolar, depressive disorders, trauma and stress related problems, as well as anxiety disorders. We are also providing other services such as assistance in obtaining benefits, housing, employment, and other recovery supports. In 2022, the Mental Health Board, under Lisa's leadership, conducted a comprehensive assessment of the region's crisis continuum and provided recommendations for developing, enhancing, and sustaining behavioral health crisis services. The assessment clearly determined 4 key community needs. There was not enough community-based services to provide crisis assessment and screening. There was a reliance on emergency departments as a point of entry and access for individuals experiencing a behavioral health crisis. And there is a prevalence of psychiatric boarding in emergency departments and frequent incarceration of individuals in crisis due to a lack of community resources and an insufficient number of psychiatric beds. Coleman and the Mental Health and Recovery Board went to work to address these community needs. And that is why we are here today. Working with the state of Ohio and the Department of Mental Health and Addiction Services, today we are breaking ground on a facility that is a game changer. When complete, this building will mean that a resident of this 3-county area who previously had to go to the emergency department as a point of entry may now come here for immediate assessment and care. Another resident may no longer have to begin their care journey in a jail cell. Our mobile response teams will have a place from which to work, and the journey to wellness will have less barriers to the citizens of these counties, all while alleviating some of the strain on our first responders and other systems of care. Governor DeWine has repeatedly called for making Ohio the best state in the nation for mental health treatment, research, and prevention efforts. None of this would be possible today without the governor's commitment to mental health care. It is now my honor to welcome to the podium the 70th governor of the state of Ohio, Governor DeWine.
Patty.
Thank you.
Patty, thank you very much. Well, as Hattie told you, this is really, I think, a historic day. We're going to break ground here in a moment, and it won't be too long until this facility beautiful facility you see the picture of will be a reality. A behavioral health urgent care center, exactly what it sounds like. How many times have we heard someone say, call us, I have a loved one, we can't get them mental health care. We have a long wait. I'm told it's going to be a month, 2 months. Where do I go? You know, how many times has the sheriff looked in his jail, looked some of the jails around here and said, we have people who have mental health problems. We're not really the ones that should be taking care of them. They should be taken care of someplace else. We need help. 60 years ago, John Kennedy, in the last bill that he signed before he was assassinated, signed the Community Mental Health Act. And that act promised that every citizen in this country, every community, would have access to mental health care. The idea was that we would move to the community level. As a country, we've never really lived up to that. And we have taken it on here in Ohio. Leanne Cornyn, who you're going to hear from in a moment, is really leading this charge for me, because for me it's something that is very, very important. We are building a mental health system in this state. It is not built yet, but the groundbreaking today, and when we come back here in a year for the dedication, will be one more major step that will help Eastern Ohio, will help the Belmont and Harrison County and Monroe County residents. It will be the place for them to go. This provides walk-in. Someone will be able to walk in the problem. Also, telehealth will occur here, and then there'll be the mobile response stabilization services. We're delighted. This is being taken on, and we're just happy that we are moving forward with this. This is a project. It's about $7.3 million. We want to thank the local board. We thank them for the survey that they did, which kind of told the needs that you see in the community. This action is based upon that and based upon what we've heard from citizens. The project costs about $7.3 million. The state is putting in $6.3 million of that. And we appreciate the local support and the local help as well. I want to thank the members of the legislature who've been very supportive. Every time we've gone to the legislature and said we need help, we're really building out this system. The legislature has been there for us. We're very, very grateful. Representative Don Jones, Senator Chavez, Representative Ferguson, all have been very, very supportive of this. And so we thank them very much. I again want to thank Lisa Ward and her board for their actions in this area. We are a local government state. Things don't happen unless they happen locally. We can't run things out of Columbus. We don't want to run things out of Columbus. It doesn't work that way. It has to happen locally. We can help, but ultimately things happen right here. So we're just very, very happy that this day is here. When I drove up here, my first thought was, what a beautiful site. This is just absolutely beautiful. So for families in Eastern Ohio, this is a good day. This is a step forward. For the state of Ohio, it is one more step forward. We are having locations like this around the state. And it's going to take a while to get them built and get them manned, but we're making real progress. Our goal for every Ohio citizen is for them to be able to live up to their God-given potential. And for people to be able to live up to their God-given potential, barriers have to be removed. It's about education, it's about doing all the things that we know that are important, but it's also about removing barriers. And so if someone has an addiction problem that's untreated and they're not getting help, someone has a mental health problem and they're not getting help, it's very difficult for them to live up to their full potential. And they suffer, their families suffer. So this building that will be built here is about hope. It's about hope and it's about opportunity. Let me now introduce Leanne, who will tell you more about what the mission is. Leanne?
Thank you, Governor, for the introduction and for your leadership. Truly, without Governor DeWine's unwavering support of the behavioral health field and the generous financial support of our State General Assembly, we would not be here today. Today is so much more than a groundbreaking. As the Governor said, it is a celebration of hope for this community, for the men, women, and young people who will be served right here on these grounds. And as Governor DeWine said, we are all about creating hope. At Ohio Moss, we are working harder than ever to make Ohio the heart of hope. And that means a world-class destination for behavioral health care, where every single Ohioan, regardless of their circumstances, can access the services and supports they need to be well, get well, and stay well. And in a matter of months, the residents of Belmont, Monroe, and Harrison counties will have access to behavioral health care that was previously not available in this community. We all know that the need for crisis services, like those that are going to be offered here, have never been greater, especially in the midst of a national mental health crisis. In the past, individuals and family members have had to drive hours to access the kind of care that their loved ones need, but not for long. This facility will connect adults and young people to vital services close to home when and where they are needed. And as the Governor mentioned, one of those services is mobile response and stabilization services. And this is a new program that, under the Governor's leadership and investment from the General Assembly, that we will be scaling statewide. It's a program where behavioral health professionals are deployed right to the location of a young person under the age of 21 within an hour of someone calling and saying that that child is having a behavioral health crisis. That is why, under the Governor's leadership, we have committed $12 million to bring MRSS statewide, and we look forward to launching this service early next year. This project is truly emblematic, as the Governor said, of projects underway all across the state to expand the array of crisis services here in Ohio. It's just one more example of how we are working to deliver on the Governor's promise to build the system of care that was never built. So it's really only fitting that we are gathered here right on the heels of Recovery Month, which is a national observance held every single September to recognize the importance of evidence-based treatment and recovery practices. We know that treatment works and that recovery is possible. And today's groundbreaking is an important step toward recovery and wellness for the residents of Belmont, Harrison, and Monroe counties. So congratulations to Lisa and the entire team at the Mental Health and Recovery Board, to Hattie and the whole team at Coleman. We are so appreciative of your commitment to the Governor's vision to build out crisis care in our state. So with that, thank you, and I will turn it over to Lisa.
Good afternoon and welcome, everyone. On behalf of the Mental Health and Recovery Board, I'd like to thank Governor DeWine and Director Cornian for joining us today for this groundbreaking ceremony. I'd also like to acknowledge and thank Deborah Yater, who is our board chair, and she is with us today, as well as some other board members we have present in the audience. So our Mental Health and Recovery Board is one of 50 in Ohio, And we are a local public agency empowered by the Ohio Revised Code to establish a system of care for mental health and addiction services. And as a local entity, the Mental Health and Recovery Board is uniquely positioned to identify our changing community needs, respond to crisis, and also move quickly to come up with solutions. What I'd like to do is focus on the change today. I would like to talk just a little bit about how we got where we're here today to this celebration. Hattie stole some of my moments, so I'm just gonna piggyback on some of those though. As mentioned earlier in Hattie's remarks, in April of 2022, the board engaged with TBD Solutions, which is a national leader in crisis consultation, and they're out of Michigan, but we won't talk about that. But they came in and they did an absolutely fantastic job over about 7-month period of time looking at our system. The process included several months of meetings, interviews, they did site tours, we had consumers and family members at the table, and we actually had a group of over 17 of our local partners at that table. At the end of that period of time, in August of 2022, we were presented with a 58-page report on the outcomes of that crisis assessment. I'm someone who, likes to rip the Band-Aid off and let me see the bad. And yes, there were lots of strengths, but we did have some challenges, and we knew that, and we finally were able to get them out and find partners that were willing to work with us. One of them said that the current crisis system network in Belmont, Harris, and Monroe counties is referred to as scarce, inefficient, and lacked capacity to meet the demands of the community. That was not easy to sleep with. So we knew we had to get busy, and we did at the board. And immediately we were at the time when we started our new CAP plan with Ohio Moss, and we were starting our new strategic plan for the board. And our goal was to make sure that Belmont, Harrison, and Monroe counties had a full continuum of care that was accessible for individuals in crisis. So we started out in June of 2023. The Mental Health and Recovery Board applied to OMOS for the ARPA Crisis Infrastructure Funding, which the governor mentioned earlier, which we received to start the program here we're celebrating today. I like numbers, so you're going to hear a few. So just in the past year, Coleman, with their current mobile crisis team, has completed over 577 screenings. That is 7.5 times more than when I started in 2019. So when you think about the need, that's probably only going to continue to grow. In June of 2023, we also started crisis coalitions in all 3 of our counties. So we have local crisis coalitions that meet in Belmont, Harris, and Monroe. They're made up of various stakeholders. And the purpose of that is for us to get together and figure out what local resources and partnerships can we bring together to help individuals avoid a crisis situation. I'm happy to say that since 2023, we're a year and a half out, and those crisis coalitions are still viable and they still meet regularly. We didn't stop there. In August of 2023, the Mental Health and Recovery Board held an open house for the Belharmon Recovery Center. It is located in Barnesville, and it was established with OMOS crisis infrastructure and stabilization dollars and local resources. It is a detox withdrawal management center. And since January of 2024, we have served 118 individuals with a 76% successful discharge rate. One more, we had in September of 2023, as the director mentioned, we applied for an Engage grant through Ohio Moss to start up an MRSS team. Belmont, Harris, Monroe were one of 3 of many counties in Ohio who were without that special response team for families. We are happy to say that we have partnered with Coleman on that, in just a little over 45 days of operation under Casey's leadership, they have served 7 families. We also have a special partnership that I can't not mention, which is with the Cumberland Trail Fire Department. While we were working on our initial crisis assessment survey, we found that we had a partner with them. Their Belmont County Cares team is a resource. If you're not aware of that, they go out and they get a lot of calls, and they were often getting calls from individuals who were presenting with substance abuse and mental health issues. So the board funds one of those positions, and I can't tell you the growth in the last year and a half. They are definitely a partner. Actually, in the last 6 months, over 50% of the calls that they have gone out on have been in partnership with the Coleman Crisis Team. So last, I will leave you with some other numbers. As we talk about changing the narrative, I wanted you to know that in fiscal year 2024, the Mental Health Board invested $1.7 million in crisis services for Belmont, Harrison, Monroe. I'm going to stop here, but I want you to be assured we're not going to stop composing the new narrative for crisis services here in Belmont, Harrison, Monroe. And we don't work alone. It's without many of you in this room that none of these things could be accomplished without the partnerships we have from not only our local service providers, but also our other community agencies. In closing, I would like to express my sincere appreciation to Governor DeWine for his leadership and investment in behavioral health services for Ohioans, and our ongoing partnership with OMOS under leadership of Director Cornian and her staff to support and continue to support the local expansion of our services. I'd also like to thank Coleman Health Services, Hattie Tracy, her staff, and your board of directors for investing in our community and being committed. And finally, I would like to just acknowledge the hard work of the staff that joins me at the Mental Health and Recovery Board and our board of directors who never lose the sight of what our mission is, and I'm proud to be a part of them. Thank you.
Thank you, Lisa. Appreciate all that you do for mental health services here in Belmont, Harrison, Monroe County. We're going to turn some dirt, but before we do that, I wanted to make a few introductions. First, we have the mayor of St. Clairsville with us, Catherine Tallman. Catherine's here. Caleb Shriver is here from J.D. Vance's office. And from Representative Ruley's office, we have Amber Kohler, who has a proclamation, I believe. She'd like to present to Lisa and to Hattie. If you guys can come up.
Thank you. Again, my name is Amber Kohler. I am the Deputy Director of Ohio's 6th District, Congressman Michael Ruley. He unfortunately could not be here today on this beautiful day in our district, absolutely gorgeous. But he did want me to present this proc. Before I do, I would like to state a couple of things. I've worked here for many years in Ohio 6, and one of the things that we have always fought for is getting recognized, getting funding, getting these issues, whether it be mental health, internet, so many things that we lack here in our Appalachian region, and Governor DeWine has really put forth everything he could to support our people. So I really just want to thank him today. The Congressman wants to thank him for everything you do for our district. With that, a proclamation recognizing behavioral health urgent care on the occasion of its groundbreaking. On behalf of the people of Ohio 6th Congressional District, I am honored to recognize the behavioral health urgent care on the occasion of its groundbreaking. The Ohio Department of Mental Health and Addiction Services, the Belmont, Harrison, and Monroe Mental Health and Recovery Board, alongside Coleman Health Services, recognized the need for the citizens of Belmont County to have accessible health care. The Behavioral Health Center provides medical practice needs and caring professional and committed environment. The facility will include an 8-bed crisis stabilization unit, assessment rooms, as well as access to the Coleman's mobile response team. This urgent care unit will significantly impact families from all around the country or community. With great pride, I congratulate Behavioral Health Urgent Care on the occasion of its groundbreaking ceremony. I thank all of the organizations involved for their determined and compassionate spirit and for their service and dedication to the community. I wish the Behavioral Health Urgent Care all the best in its mission. Signed on this day, the 2nd of October, 2024, Michael Ruley, Member of Congress. Thank you.
Great, thank you, Amber. Okay, we're going to move some dirt, but before we do that, I want to introduce you to the people who are going to be here holding some shovels. Our architect for the project is David Potts from Plus Detail. He's going to be to your left as you look forward. Casey Osselborn is Coleman's Chief Officer for Belmont, Harrison, and Monroe. And then we'll have Hattie Tracy, who you've already met, Governor DeWine, Director Cornian, Lisa Ward, and then Deb Yeater, who is the board chair of the Mental Health and Recovery Board, and Paul Becks is the president of Welty Construction, who is the contractor for this project. So if you guys want to take your positions, we'll move this podium and